Bonjour, alors Madame McVeigh va faire une courte déclaration en français. Ensuite, on va passer à une courte déclaration en anglais et une période de questions d'environ.
So there will be a short briefing in both French and English and then a question period. So hello everyone. Thank you very much for having come here today. We wanted to let you know what the situation is at the CHSLD Maison Herron is. In the past 24 hours, a lot of information about the residents was brought to the attention of the Ouest de Montréal CIUSSS, and we have communicated with the authorities at the ministry as well as the police forces in order for an investigation to be started. We have also declared public health, the Montreal region, or we declared to them the situation. Chronologically, the events on the 29th of March, the CIUSSS intervened in support of the owners of the CHSLDs as support to their activities. Despite this, we found that we didn't have much collaboration on their part. We tried many times and emitted 2 orders from the Direction of Public Health. After the order on the 8th of April, the law article 106 of the Act on Public Health allowed us to have access to the files of the patients as well as information, minimal information, on the coordinates of the families of the residents. In the past few hours, we have learned, after analyzing the medical files, all of our interdisciplinary teams were involved, that there have been 31 deaths since the 13th of March 2020. Of these, 5 are confirmed as being COVID-19 positive cases, of which 2 which were registered last evening by our spokesperson. So we are investigating the circumstances around these deaths. The medical analysis with all the investigations will allow us to know this. I wish most particularly to offer our sympathies to all families, and I promise you that we will be communicating with you to give you the state of the situation of your family members. I'm sorry, but this really touches me, that the members of the family are so anxious about the people who live here. We presently have a team on the premises that is contacting the family members to let them know what the health state of their family members are. I am telling you that there are specialists who supported the teams at the Herron residence to evaluate the state of health at each of the residents today. And our promise is that we are going to be contacting the families to let them know what the state of health of their family members are. We are setting up every necessary effort to keep everybody informed about the advancement of the situation. The family members can contact us at any time. You have had calls without answer, but at all times you will have an answer from 8 in the morning at 8 at night. 514-630-2123. So 514-630-2123. We have nurses, we have administrative officers who will be answering your questions. We thank most particularly our employees, our professionals, our doctors, our volunteers who raised their hands at the CIUSSS de l'Ouest and who came from St. Mary's, from Lakeshore, from the SHLDs to be able to give a hand to the residents and families of the Herron house. Our teams are on the premises as we speak in the residence and are fully operational. I will speak English, and then I will be answering your questions first in French and then in English.
So thank you very much to everybody for having come here today. It is my important priority. My name is Lynn McVeigh, President CEO of the CIUSSS Ouest de Montréal. It is my priority to give you information that we have regarding the private nursing home Maison Herron on our territory. In the last 24 hours, information has come to light about the situation of the residents at Maison Herron because our teams have been analyzing their medical dossiers. And it has come to light to us that we needed to contact police authorities and ministerial authorities because when we analyzed the medical records, we noticed that there were 31 deaths since the 13th of March. In terms of the chronology of the events, on the 29th of March, we reached out to Maison Herron. We knew they were having difficulty staffing, and we offered to provide help. We brought personal protective equipment for the staff to protect the staff, and we focused on evaluating the patients. We had little collaboration with the owners, unfortunately. These are extraordinary circumstances. We had two formal legal notices asking for them to give us information about the residents and the coordinates of the families. After the ordinance was delivered by Public Health on the 8th of April, Article 106 in the Public Health Law of Quebec gave us the opportunity to actually access all the dossiers and the clinical records, and we had to actually work with pharmacies in the community to get addresses and phone numbers of the patients. So we are shining a light, we're shedding some light. The medical and coroner and public health analyses are going to shed more information about the results and circumstances about these 31 deaths. We offer our most sincere condolences to the families at this very extraordinarily difficult time. We understand that it's really hard to have a member of your family in a long-term care facility and not to be able to visit because of the public health law. So we are communicating with each of the families now. Every family will get a call today, and any family who wants information about the resident is invited to call from 8 a.m. to 8 p.m. 7 days a week. Our phone number that we have made available, CIUSSS, 514-630-2123. We would like to take a moment to thank our employees, to thank our volunteers, our physicians, our multidisciplinary teams who raised their hand and said, I would like to go there to make sure that the residents are okay. We're going to evaluate them, and we're going to let you know how they're doing. And that's exactly what's happening today with specialists that have gone in to evaluate each one of the residents. Our teams are there now in Maison Herron, and we are going to focus in on the health and safety of every resident that is in the long-term care facility. So at this point in time, I would like to open to questions in French, s'il vous plaît. Des questions en français, s'il vous plaît.
There's all sorts of information that we've heard on the conditions in which the residents were found by the CIUSSS on the 29th of March last. We spoke with family members. They've had no official confirmation of that information. I would like to hear you tell us under what conditions these elderly people were found on the 29th of March. We know that there was a lack of staff. We know that some employees deserted. What conditions did that leave the residents in? Yes, absolutely. On the 29th of March, we had our Director of Professional Services, a doctor, and our Director of Support to the Elderly who came in, who found in the present situation that we had to bring most particular attention to the hygiene of each patient, ensure that they were both changed and fed. What was important here is that there was not enough staff to take care of all the staff that was here. Our teams took over. Our managers and professionals came in that night. We washed patients, we fed them, we changed them. I'm sorry I call them patients, but they are residents. For us, it was a situation that we found that we had to lend a hand to. We send members of the staff of the CIUSSS of Ouest de l'Île for some shifts, but it was enough. We were supporting, collaborating, but we had a hard time finding solutions together. And that was why the letter in the order. I assure you today that after the evaluation of all the patients, that they're being taken care of correctly, their prescriptions are filled, the medication that they have to take, they are taking right now. Is it confirmed that there are people who were found dead in their beds on the 29th of March? And if so, how many? I want to be very clear on that. We did not find residents who were dead in their beds at the Herron residence when we arrived on the 29th of March. There had been one patient who was transferred towards the Jewish General Hospital. That patient died, and another patient died during the course of the evening together with our teams. Inaudible question? Are you blaming? The law allows us to offer a support to the private CHSLDs on our territory, and that is what we offered. We offered our staff to go fill shifts that were understaffed. We were not necessarily in a collaborative mode with the owner, and we did not have access to the medical files or the medication that was supposed to be delivered to those residents. So that was corrected on the 8th of April with the order on the part of public health, and now we can see we are shedding light on the clinical situation of the residents since we arrived and since we started analyzing. But yesterday, a spokesperson from the CIUSSS at the Residence said that everything was going well. Can we trust that, what the CIUSSS was saying? Yes, we sent a spokesperson at the end of the day, and at that moment, our teams were deploying their analyses. The pharmacists, the doctors, that was in the middle of the night, the Premier said so. At 9, even a little bit later, close to 10 p.m., that we had the doctor who called us to report to us that since the 13th of March, there had been 31 deaths. And you got that information yesterday? Yes, yesterday evening. And we worked all night to set up a communication program together with the families. The residents and families is first and foremost. We sent a letter to the families last evening. We gave the telephone number, and that is our priority today as well. As I mentioned, we were supporting La Maison Herron. It's a private CHSLD, and we did not have access neither to the names of the patients, the medical files, or the addresses and telephone number to contact their family members. So that was our priority. We tried really hard. And then finally, on the 8th, with the order, we were able to set up a list of the names of families and telephone numbers, and we were able to start entering in contact with the families. Are there family members who will learn the deaths of their family today? For the 31 patients, we spoke this morning with the doctor who made the analysis, and we also spoke with the group of doctors that are working in the Maison Herron. The doctors, when there is a patient who is doing badly, contacts the families of that resident. So you won't be announcing deaths to any family member today? Individual deaths? No. The 31 families were reached by our doctors at the time. Since the beginning of the COVID-19 crisis, have there been hospital patients that could have been sent to the Herron CHSLD? I don't have details, but my understanding is that the law on public health, and at La Maison Herron, we had COVID-19 positive patients, so our main priority was to put them all together in order not to infect others. So normally there's no visitors and there's no admission within CHSLDs at this time. Apart from the 5 that were confirmed as COVID-19, the other deaths, are we sure that it's not COVID-19, or we're waiting for analysis? We're waiting for the medical analysis, and then we'll know. Your employees right now, are they helping out other CHSLDs on your territory for the same kind of situation of lack of staff? Thank you for the question. Yes, absolutely. So the West de Lille has an interdisciplinary team that is doing a tour of all the private CHSLDs today, and we regularly have been doing it in the past 10 days within private CHSLDs. That's the reason why we had communication first with the Maison Herron first. You're saying that they had a regional agreement of services with the CIUSSS de l'Ouest here at Herron House. That means that the CIUSSS not only had a support role, but a surveillance role. Were there surveillance and monitoring visits? We have a certification program for the private CHSLDs. And in fact, there were reports that were emitted, amongst them that of the Commissioner in July 2017, as well as a certification of the Maison Herron with recommendations for the improvement in the quality of the service offering. In the context in which we were worried before the pandemic, we were offering support, particularly for nursing care in training to the teams. But right now, as you know, we are taking over with the management now of the residents and families to take care of the residents together with our interdisciplinary teams. So when was the last time that the CIUSSS came? Well, within the context of the pandemic, we created multidisciplinary teams, and they regularly visited all private CHSLDs over our territory, including la Maison Herron. And since the beginning of the pandemic, once or twice we went in, and that is, they knew us, and they raised their hand to say, can you help us find staff? So there was already a certain collaboration with the Herron House, because you said that there wasn't for COVID-19. We had written confirmations that there was collaboration, that they wanted to work with you. What do you say to that? We said that the collaboration was difficult. We opened communication channels. We did not have the necessary tools to take care of the residents. We wish to have better collaboration, that's for sure. And in extraordinary situations such as these ones, it's not always easy. But taking care of a resident, in order to do that, we need the medical file, and we need access to that medical file. We need access to the equipment that is required within Herron House to be able to care for the patients. So on the 8th of April, we had that collaboration after the order. It improved more and more, and we made our analyses, and we see the results today. So I think that we'll go to the English questions. How do you justify the absence of collaboration on the part of the group? I didn't understand. How do you explain the absence of collaboration from that group, the Kataza group? Well, we tried communicating with them many times. We had a dialogue with them, and we had the residents in front of us. We did the best that we could under the circumstances with the letter for the order. We finally had the medical files as well as the equipment that we needed in order to evaluate the situation as a whole for each of the residents. English questions?
Found on the 29th when they entered, both in terms of the condition of the residents and the number of personnel that had abandoned the center.
So from the point of view of the 29th of March, which was a Sunday, which I remember very well because we were very, very worried about the residents and families at Maison Herron. And on the 29th of March, our Director of Professional Services and our Director of Elder Person Care went into Maison Herron, and what we found particularly was not enough personnel to take care of the residents that were there. We immediately rolled up our sleeves, put on the personal protection equipment, because protecting our staff is our main priority. First come the residents and families and patients, and then protecting our staff. And so we donned our personal protective equipment, and we went and fed patients, changed patients, made sure they were ready for bed, and that is what happened on the 29th of March.
Specific about the number of personnel that were still in the center at that time compared to the number of residents? Not from your team, that were still working there when you got them.
Working there. We know that they were struggling to keep their ratios of staff to residents, and they'd asked us for help, and we did provide on some shifts help to go into the residents to help care for their patients. We wanted to collaborate, and we saw that on the 8th of April, when we got our letter of ordinance and we were able to work with the owner to access the clinical charts, that things started to get a lot better in terms of being able to evaluate the patients. We were in a process of evaluation, and we saw from the clinical dossiers of the patients at that point in time, the physician did a full analysis retrospectively and found 31 deaths had occurred since the 13th of March. We thought it was very important to get that information out publicly.
You could not contact the families before April 8th? Is that correct?
We did not have the phone numbers or addresses or names of the families before April 8th.
The families were kept in the dark for all that time, now that they know the situation.
I'm very sorry that you were kept in the dark. Our mission in health and social services in the public health care system is to put residents, families, clients first. And we are very concerned, and we are going around to visit all our private long-term care facilities. We are concerned. We want to make sure that residents get to communicate with their families. We haven't been perfect, and in our private nursing homes, we have staffing concerns. We have increased our capacity of the health and social services system, but now what we see with Maison Herron is that we need to have very specific measures where we create a list of who are all the residents, what are their phone numbers, what are the phone numbers of their families. And that's what we created, and now we're systematically going through making phone calls and speaking to families. And that, for me, is really the first priority. When you have a relative in a long-term care facility, frequently they're visited by family, by volunteers. We have the public health law that does not allow them to come in. And I'm sure you can imagine what that's like as a family member, to have a relative that you actually can't visit or communicate with. But that's the public health law. We are in this crisis, this pandemic. Our goal is to save the most lives possible. And we are working 24 hours a day, 7 days a week with that mission.
How many confirmed or suspected cases of COVID-19 are there in Herron right now?
So from the point of view of the tests that we're doing, the 5 were confirmed amongst the 31 who passed away. We know that we have a cohort of somewhere between 0 and 10 patients at any given time who are waiting for results for COVID-19. We also have some positive patients. We follow directives of Public Health Authority in Montreal and in Quebec. We create red zones for positive patients. We create yellow zones for those waiting for results. And we create green zones for those who are not affected at all. And we divide up our staff accordingly so that the resident has the least amount of different faces and individuals taking care of them at any given point in time.
So our information is on the 29th, you went in. There was a nurse that we spoke to that said conditions were absolutely not livable, frankly. Patients, residents were covered in their own feces and hadn't been fed, and there was no staff in sight. You brought in some of your own staff. Over the course of the next couple of weeks, we understand that there were at least 12 deaths while the CIUSSS was involved. Patients or residents as recently as Thursday night hadn't been fed and were dehydrated. So can you speak to the level of care that you were able to provide once you were aware of the situation?
So there are 2 times. Once we were called in to provide support and help on the 29th of March. That's when we began to engage in a partnership with Maison Herron in support of their administration, and we realized that they were having difficulty staffing, and we came to their aid by providing some staff on some shifts at different points in time.
It's going to be our last question.
Well, we might have a few more, actually, if that's okay. There's 31 dead people, so I think there's some questions that we're going to ask.
Take one more after this.
You went in, so on the 29th, you decided that you were going to have a partnership with the owners instead of taking control of the situation. So there were dead people.
The law in Quebec, the law of health and social services is very clear on this. When there's a private organization, a private long-term care facility, it is the owners that have the responsibility to staff that long-term care facility. The law is clear on that. When we get asked to go in by the Ministry of Health to see what we can do to support in the middle of a pandemic, we bring personal protective equipment, we bring training programs. That's what we brought. What we discovered when we were there is that there were not enough staff on site to take care of the basic daily needs of the residents. And so, yes, we changed the residents, we fed the residents. There was a period of time of several hours where that was not occurring. We, from the point of view of our Director of Professional Services, who's a geriatrician, a physician who works with elderly patients, as well as our Director of Elder Person Care and a very experienced nurse who's a coordinator who went in. They evaluated the patients. There is, in no circumstances did we find any patients who were either that were lying in excrement, as I've read in the media. We found patients who needed to be changed. They needed to have their protective clothing changed, and that we proceeded to do that. They needed to be fed, and we proceeded to do that, and we proceeded to get them ready for bed. We did not have access to their medical records at the time, nor did we have access to what medications they were taking and how to deliver them to the residents.
That's our last question.
When did you first request to have the Health Act take control so that you could take control of the residents completely?
So on the 29th of March, I had a communication with the ministry because I wanted to be able to go in and be of support to Maison Herron on a more sustained basis. I would have liked to have had more collaboration. We were required to send formal notice on 2 different occasions, and it wasn't until we got the ordinance letter from Public Health Montreal that we had the legal authority to go in and look into the charts, into the medications that the patients were on. You okay?
So we're going to close on this.
The details that you brought, for how long, since how long had the residents not been fed or changed? Our evaluation, it's a specialist doctor for the elderly, as well as experienced professionals who evaluated the patients. And what we found was that during the day, there was not enough staff to take care of the basic needs of the residents who were present. Our teams came in. We took care of the residents. We entered into collaboration with the owner. The communications were not easy. We did our best to be able to support. On the 8th of April, the letter of ordinance arrived. We got a lot more information at that time, and it is at that time that we made all of our analysis and that we can reveal today what the situation is, because we want to be transparent. My last message, English.
To the families and the residents of Maison Herron and of the CIUSSS de l'Ouest de l'Île de Montréal, you come first. You are our first priority. Communicating with you as families, we know has been challenging. We're continuing to work on it. You are our priority, and that's where we're going to focus our energies. I'm going to have to go back and continue to work with our teams now to take care of all of our residents, including the residents of Maison Herron. Alors, le dernier message.
So for the last message that I wanted to say is for the family members and the residents who are separated from their families during this health crisis. You have our fullest sympathy. We're going to be working very hard 7 days a week to communicate with you and evaluate and take care of the residents who are in these residents. We thank the support that we're getting from the Ministry of Health and Social Services and the government. And during this pandemic, we will continue working. I'm leaving you since the teams are waiting for me so that we can continue working. Thank you very much. Goodbye.